Welcome back. Statistics show THC is the most common illicit drug used during pregnancy, and doctors say they are seeing more children born with the compound in their systems. And that's why we are highlighting the issue in an hour-long special tonight here on Channel 4. But right now, this morning, Susan Pittman, founder of A Drug-Free Duval, joins us live via Zoom. Good morning, and thank you for being here.
Good morning, Ashley. Thanks so much for both talking about this issue today and tonight.
Absolutely. So let's start off with this. What are the most common effects that THC use during pregnancy has on a child? Can we talk about that?
Sure. On a newborn, the issues are very similar to like cigarettes, which of course we know are being asked not to be used during pregnancy. Things like low birth weight, slower development, early stage, and then even an increased risk of stillbirth.
You know, that's really concerning to think about, but let's also talk about the future. What effects can that happen later on in life? Because that's a major concern as well.
It absolutely is. And, this has all happened so quickly that this is emerging understanding and data. But at this point, researchers and pediatricians and obstetricians are warning that there's an increased risk of ADHD, of your child developing ADHD, other cognitive impairments, memory and learning disabilities, the increased problem-solving skills, behavioral issues, and certainly the development later of mental health issues related to schizophrenia and other psychoses, and the risk of addiction, the increased risk of addiction for this baby who has been exposed to THC in utero.
So, Susan, I have to ask, why does it seem that more women are willing or comfortable to smoke or use marijuana during pregnancy? Can we talk about that? Because we need to understand it.
Absolutely. And I think predominantly you'll see in the panel discussion this evening that everyone cares. And there just seems to be a real big lack of awareness. Again, this all just happened so quickly that the reality is the research hasn't been able to keep in front of the issues that are developing. So lots of moms have a really low perception of harm, and we understand that. It's medically approved in our state. It's medically approved in most states in the United States. But the problem is there's a lack of consistency of the product and all kinds of stuff. There's confusion and really a big lack of awareness. So we want to get the awareness out there and help moms make the most healthy choice that they can make, because we know that they want to do that.
And we know that the research, a lot of it is brand new, but can you walk us through maybe some of the myths surrounding THC and pregnancy? Can we get those out of the way right now so people are aware?
Absolutely. And I think the key myths that I wanted to share this morning, we go over a few more tonight, but one is that marijuana is not addictive, and that is absolutely a myth. We used to think that there was really low levels of THC, but it is very clear it's part of the DSM, which is sort of the Bible for physicians in terms of diagnosing something. There's something called cannabis use disorder. It is addictive depending on the first age of exposure. That addiction possibility increases, so it starts out maybe 1 in 6 people exposed can become addicted, all the way up to 1 in 10 or 11, depending on the age of onset. So that's a myth I'd like to dispel, that it is not addictive, because it is. And the second thing is that it is a better method for addressing morning sickness than other methods that are out there, because the reality is marijuana has not really been tested. It will work. It will reduce morning sickness. But unfortunately, the side effects, as we've already talked about, are really, really grave. And so there's all kinds of other really great products. You can suck peppermint. You can take ginger. You can take vitamin B6. There are other prescribed medications, and they are safer. They have been studied for the long term. We understand the impact both on the fetus and mama. And so we really, really encourage, there's even things like meditation and breathing techniques. So we really want moms to consider that it is not a safer way to deal with that really crazy morning sickness that lots of us get when we're pregnant.
I remember those days not so fondly, but before we go, we only have about a minute or so left. What local programs to help educate and treat pregnant people who may be putting their child at risk? Can you talk about any programs?
Absolutely. And this is another thing we really want to get out there. We have a local coalition that's committed to, from cradle to college, the health of babies. It's called the Healthy Start Coalition, and they have 3 separate programs. And one of the most exciting programs they have is called the Rose Project. And the Rose Project provides peer mentors that will walk alongside a pregnant person during the pregnancy and even for a year after, because that's a really high risk of continuing. It's very stressful postpartum, and breastfeeding is another time that it's risky to be using marijuana. We also have Daniel Memorial that has powerful programs to work with families and individuals and moms, and that's a really great program. Drug Free Duval, we have all kinds of prevention work that we do, and we'll come to any group and provide it. We'll work with obstetricians and gynecologists, or home groups or homeowners associations, whoever you want. We'll come out and we'll share not only the risks, but also options.
Susan Pittman with Drug Free Duval, thank you so much for your time. We really appreciate it. We'll hear more from you later on today as well.
Thank you, Dash.
And again, News4JAX is continuing the conversation about this very important topic tonight, right here on Channel 4. News4JAX anchor Melanie Lawson will speak with a mother who used drugs while pregnant, also a mental health expert and an internal medicine doctor, about the confusion surrounding THC and pregnancy. Clearing the Air, THC and Pregnancy airs tonight at 5 o'clock. In the meantime, if you have any questions or concerns regarding THC and your baby, call the Florida Poison Control Helpline. You see the number there on your screen, 1-800-222-1222.